So, welcome to today's webinar and today's talk. So, today I want to talk to you a little bit about the idea of Sarcodes and especially some thoughts about how to use them clinically. Because what happens about Sarcodes is that it doesn't come in repertory, it doesn't come in rubrics, so we don't normally think about it. So, there are many Sarcodes and there's a lot of work that's happening. But I want to give you some ideas as to how I use Sarcodes so that you can pick up some very important ideas. So, first of all, you need to understand what are Sarcodes. So, Sarcodes are remedies which are made from healthy human beings and animal tissues. And especially, when do we use it more? Basically, these are many of the remedies that we are using in Sarcodes like thyroidinum, cortisone, insulin, pituitarium. They are often hormones. So whenever the normal functioning, either there is a hyper functioning of something or a hypo functioning, or something in the body is either overdeveloped or underdeveloped, especially in a metabolic disorder, developmental disorder, I use a lot of Sarcodes. The key word often could be a lot of hormonal issues, a lot of growth related issues. So a lot of pediatric cases I'm using the Sarcodes, a lot of developmental issue. Either there's a strong hypertrophy, a lot of speed issues, so even restless autism kids, or a lot of panicky disorders, a lot of atrophy, tumors, a lot of fibromyalgia, lethargy, so many things. So let me give you a little bit of clinical ideas that I'm doing. And there are many Sarco remedies, and I've used this quite often. My inspiration to use this more was my guru Dr. Sarkar from Kolkata. And there are many remedies: Uforinum, Pituitarium, Parathyroid hormone, cortisone, insulinum, thyroidinum, testes. Testes can also be used. Adrenaline, histaminum, and there are about 10-15 more. But just to give you a brief idea, just important points, so maybe you can use it clinically and you can write to me how you're using it. Let me start with my first remedy, Uforinum. Now this is a remarkable remedy, and I've used it especially in especially age group between 40s and 50s, where they have developed osteoarthritis and a lot of hot flushes, osteoarthritic changes in the legs, in the knees, early menopausal symptoms, and depression. And you're giving a typical remedy, you're giving a CP or an atramure, but it's helping but not helping. Very often I've used Uforinum in 200 or 1M potency, and it has helped beautifully. Let's look at another remedy, the remedy adrenaline. You need to understand it's from renal, suprarenal organ. The main thing I've used it in is a rapid BP. So whenever there is a rapidity of BP, sudden rise of blood pressure, like coffee cruda, sudden BP rise with a lot of tightness in the chest, this could be a sign of angina. So you need to do a sonography, you need to do a ECG, etc. But when this happens and ECG is normal, think of adrenaline in a high potency. It remarkably works. Parathyroid hormones. So if you're seeing cases where there is a lot of calcification, so renal calcification, a lot of calculi formation, infarcts in the brain, atherosclerosis, this is the idea of using parathyroid hormone. Insulin. This is also one of the remedies of today's generation. Mainly I've used this remedy with very high blood sugar, diabetes, but along with that, especially the liver and kidneys damage, and patients are taking insulins, the injectables, and that's causing a lot of side effects. So I start with insulinum in low potency, maybe 30, so that slowly, steadily I can reduce the allopathic insulin dosage. But one thing where I've used it fairly often is in cases of diabetes with a lot of ulcers of the leg, bed sores, diabetic foot, or a lot of infections. So in diabetes cases with a lot of infections, you can use insulinum. These are all organ remedies. So you won't find it in rubrics. So sometimes when you have to think out of box, think about this. Another, for example, remedy I use very often is cortisone. So patients come to you and they, suddenly they feel a bloated feeling, they get a buffalo hump here, swelling of the face. Very often, even in PCOD, you will see this kind of symptoms. But when you do the reports, all the reports are normal. But still, they are showing symptoms as if that of Cushing's. In these cases, I've used cortisone. Fantastically well. Another interesting remedy which I use is testes. Testes in potentized form I've used in cases of PCOD. This remedy I've learned from Ashok Borkar from Goa. He uses this very nicely. Another remedy is Histaminum. I like to call Histaminum as the fast apis, which means there is a lot of hurry, impatience. They can't wait. So if you see your patient who's in the follow-up, who's waiting, and his time is going to come up to 5 minutes, but they can't wait, and the patient just goes away because he can't wait. Think of Histaminum, and it has urticaria like that of apis, better by cold water. There is also another remedy, thyroidinum and pituitarium, but I'll make another video because they are very long remedies and I want to give you a really broad idea about it. So these are just brief ideas that I wanted to give you, just some pointers so that you can know how to actually use it. You can write to me a little bit about your ideas. Even you can apply these ideas and write to me. Thank you.